name is Dr. Stephanie, and I'm a pharmacist in the Dallas area. A pharmacist is a healthcare professional who, in general, has gone to school that's prepared them to be a medication expert, so to speak. So we learn about the different medications a patient can take, how they work, the side effects a patient might experience, what dose the patient should take, how often they should take the medicine. So we can use that information to either counsel patients or to be a drug information resource for other healthcare professionals. And we can also, in certain instances, be used to select medication therapy for patients. A pharmacist is not a medical doctor. The degree is called a Doctor of Pharmacy degree. So in a professional setting, then you may refer to a pharmacist as Dr. Smith. But we're not medical doctors. We do not diagnose diseases. We do not go to medical school. It's a completely different degree. But we do learn about the medications used to treat the diseases. I became a pharmacist because when I was in high school, I liked science, and I was very interested in medications and in medications to treat certain diseases that had affected my family, such as cancer. And I thought that pharmacy would be a good initial degree to get to allow me to do research. But once I entered pharmacy school, I learned that there were a lot of different options for a pharmacist other than what I was used to, which would be your traditional Walgreens pharmacist. And on rotation, I found out that I really enjoyed working in a clinic and working with patients to help them control their blood pressure and their diabetes. So I decided that I was happy with the pharmacy degree and explored that. You're going to have to go to pharmacy school to become a pharmacist. Most schools require 2 years of pre-pharmacy education, and then you apply to pharmacy school, which is 4 years, so 6 years total. The requirements to be admitted to pharmacy schools are completely dependent on the school. Some schools do allow you from the time you come to do a sort of conditional admittance, where as long as you keep a certain GPA and you take the classes that are required, you'll automatically be admitted into the pharmacy school. Other pharmacy schools don't admit anyone automatically. They have to do their 2 years of pre-pharmacy work, and then they apply to their pharmacy school. You do not have to have a bachelor's degree, you just have to have the 2 years of prerequisites. So in general, the prerequisites are going to focus on math and science. So biology, general chemistry, organic chemistry, statistics, calculus. Most schools are going to require those. They usually do allow you to do a few electives, so if you're interested in some liberal arts classes, you can take those as well. The PCAT is an entrance exam that some pharmacy schools use in order to determine who they'll admit. But it's not required in every pharmacy school, so you would have to research where you want to go to see if it was required. So in general, the higher your grades, the better. But if you can get about a 3.5 GPA, then you're doing pretty well. Pharmacists can work in a variety of settings. The setting that most people are familiar with would be at your local community pharmacy at a Walgreens or a CVS, but we can also work in hospitals, verifying orders to make sure that the medications that are selected are correct and safe for the patients to take, to make sure they don't have any allergies to them. We can round on med teams with doctors and other healthcare professionals inside a hospital and work as a drug information resource for the other healthcare professionals and also help select medication therapy for the patients. We can work in outpatient clinics in which patients would come to see us directly, and we would help guide them in in medications to treat diseases such as diabetes or high blood pressure. We can also work in compounding pharmacies where we're making ointments or solutions that patients have to take. So there are a lot of different settings that a pharmacist can work in. If you do additional education, such as a residency, then you can work in more specialized areas, such as oncology, ambulatory care, critical care. And if you do a fellowship, then you can be involved in research. So it's 6 years to become a pharmacist, but there are also some options after you graduate to further your education and to open your options. So I would say if you're unsure, if you want to become a pharmacist but you're interested, you could see if your school offers any sort of mentoring or shadowing program. You could also go to your local pharmacy or local hospital to see if there was a pharmacist who would allow you to follow them for a few hours so that you could see what they did. If you know that you want to go to pharmacy school, then definitely research the pharmacy schools, because there are a lot of differences in how their programs are run and